I'm Emma MacIntyre.
I'm Allie McCarthy.
I'm Emily Newman.
And I'm Emma Sheils.
And we're working on creating a growing rod for the treatment of early onset scoliosis. Scoliosis is a spinal deformity that affects between 6 and 9 million Americans and occurs when your spine is formed into a C or S shape. Scoliosis is typically diagnosed by the Cobb angle. As you can see in the right-hand corner of this slide, the Cobb angle is calculated by identifying the vertebrae at the top and the bottom part of the deformity, and then drawing a line parallel to the angle of the vertebrae that is affected, and the angle between the intersection point of these two lines is called the Cobb angle. Scoliosis is diagnosed when a Cobb angle is greater than 10 degrees, and surgery is recommended when the Cobb angle is greater than 45 degrees. Scoliosis that occurs before the age of 10 is referred to as early onset scoliosis and can greatly affect growth and development. As illustrated in the graph below, the period of the most rapid growth for the thoracic cavity is before the age of 5, and critical alveolar development occurs between the ages of 5 and 10.
Severe scoliosis can result in hindered lung development and stunted thoracic growth, as well as pain and difficulty performing everyday tasks. Spinal fusion is a common treatment for adults, which involves surgically immobilizing the vertebrae with bone grafts. This is fine for adults as they're done growing, but isn't a really great treatment for children as they still have a lot of spinal growing to do. With this, approximately 40% of early fusions require reoperation, emphasizing that this procedure really should wait until the last time that it's needed. Therefore, there's more time to allow growth for the child. There are treatments that allow for growth, such as growing rods and guided growth, but these either require repeated surgeries or can result in spontaneous fusion and stunted overall growth. Therefore, there's a need for a patient-controllable and growth-compatible implant to correct early onset scoliosis.
Our approach combines a polymeric growing rod with an electrically operated telescoping lengthening mechanism. The use of PEEK polymer in the growing rod allows for the high compressive strength and good mechanical properties while increasing flexibility to decrease spine stiffening as a result of using a growing rod. The lengthening mechanism is operated using a piezoelectric polymer. This ceramic eliminates the need for magnetic implants, which can release ions into the bloodstream and also can hinder the patient from receiving MRI imaging. The rods will be held in place to the spine using pedicle screws made from titanium. The surface of the screws will be micro-patterned in order to increase porosity and roughness and allow for increased osseointegration between the spine and the implant.
The major benefit of our device is eliminating the need for outpatient visits, and also patients will not have to come in for revision surgeries to lengthen the rod, as the rod will be able to be controlled outside of the body. You can also program the distraction rate to each patient so it better mimics the growth rate. We're also using flexible rods, which will prevent the spine stiffening seen in other common implants. Additionally, by having the surface of the titanium modified, that will allow for better osseointegration. Some of the cost of our device is the FDA approval that may be needed for a wireless device, as well as the security problem that comes up when we're using wireless devices that could be vulnerable to hacking. There's also the manufacturability as well as the cost of the rod that needs to be taken into account.
There are a few different options that patients currently have for early onset scoliosis. One of the most common ones are growing rods, and these are implanted and they run along the child's spine, and then every 6 months the surgeon has to go in and manually extend them. And there are some risks with this, such as infection, implant movement, nerve injury, inadvertent spinal fusion, and the patient also has to return very frequently. And then there's the MAGEC rods, actually use magnets so that they can manually move the rods without having to be invasive with multiple surgeries. But these also have a lot of different risk side effects, such as metal corrosion with the iron. And then stapling is another option. They're less invasive and it uses shape memory staples, and it inhibits the growth on one side of the spine while allowing the other side to grow. And tethering is very similar, but it uses the titanium screws, which are connected with a cord. It allows for a lot more flexibility and range of motion, but it's only really ideal for patients with less severe cases of scoliosis.
Each of these devices has their own advantages as well as limitations. Our device hopes to combine the stability and lengthening ability of the rods while maintaining the flexibility that stapling and tethering allow the patient. Here are our references.